For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Hello, and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm today's host, Melissa Hodgson, and I have 2 guests with me today talking about heart health. First, we'll talk with Dr. Paul Stahls, a special kind of cardiologist called an electrophysiologist. Dr. Stahls, welcome to the program. We're glad to have you here today.
Thank you for having me.
So as we're focused on heart health this month, can you tell us a little bit about the kind of cardiology that you practice and what's different about that?
I treat the arrhythmias of the heart primarily, and so not only do I specialize in the medical management, but also the device management, so pacemakers and defibrillators, and provide the ability to go inside of the heart and ablate bad wires or change how the electricity is moving through the inside of the heart by modifying the tissue.
Okay, and those kinds of procedures are not the first course of action for someone who's experiencing some heart trouble. We can start with making some healthy lifestyle choices, but then once we get to the point of needing a specialist intervention, we might be coming to see you for something, maybe arrhythmia or atrial fibrillation. Can you talk a little bit about that?
Sure. Atrial fibrillation is the most common arrhythmia of the adult human in the world. Its issue is not only that it'll make half to slightly over half of the people that have it feel bad when they have it, but it puts all of the people who have that arrhythmia at risk for stroke, increased more than the general population. So the identification of that arrhythmia is very important, but also then the appropriate addressing of the stroke risk and reduction of that risk by the use of certain medications like Coumadin or some of the newer drugs, Pradaxa, Eliquis, or Xarelto.
Okay, and so when someone comes to see you, you first encounter a patient often in the hospital as opposed to in the office.
I think I'd call it probably 50-50. I think a lot of the cardiologists in town now understand the importance of what I do, and I'm seeing a lot more patients in the clinic as a referral from other cardiologists, but also the internal medicine doctors and family practice physicians as well. So understanding and appropriately addressing atrial fibrillation as a clinician and the importance of what I can offer, I think it is a very important element of patients' care, because again, addressing the stroke risk and the reduction of that stroke risk, but also talking about ablation and what we can do to get rid of the atrial fibrillation and hopefully remove the need for those stroke prophylaxing drugs and antiarrhythmic medicines that people don't often tolerate very well.
And so what you're talking about is a procedure in the hospital, but is it a same-day procedure? Or talk a little bit about that experience for the patient.
Right, so for atrial fibrillation and its ablation, we have 2 modalities that we use, 2 types of ablations that I can offer. One is where I point by point burn single small lesions to create a line of scar around the pulmonary veins that plug into the back of the left atrium of the heart, where atrial fibrillation tends to come from. The other is a newer technique developed just in the last 5 or 6 years called the cryoballoon, and that's where a balloon seats at the opening of that vein and freezes from within it to create a circumferential lesion, or a lesion that surrounds the vein, so that it creates that line of scar within minutes. And so the cryoballoon has reduced the duration of the procedure and the recovery time of patients after, and it's become a very powerful modality that we offer people now.
Great. And that's where the patient will come to St. Tammany Parish Hospital, and that's done in the cardiac cath lab.
In the cath lab, and you did ask same day or do you go home the next morning? Yes, it's as I said, a 1.5 hour, 2 hour long procedure. You spend one night in the hospital and you're home the next day, and it's all in the hospital. You're under general anesthesia so that you're very still, because I'm working within a chamber about the size of a tennis ball. Wow. So I need a very still body while the heart continues to beat, and I work within it. So it does require general anesthesia, but as I said, you're home the next day.
Wonderful. And we keep talking about some of the things that you're correcting that are going wrong, if you will, in the heart. But if you can, let's take a step back and talk a little bit about those chambers and what's going on, why it is that you wind up in that back chamber.
Sure. So the reason that age is the primary risk factor is because our bodies change in time. And if you look at the back of your hand, it doesn't look like it did 20 years ago, and nor does your heart. So the left atrium is just on the back side of that big pumping chamber, the left ventricle. So there's very high pressure. In fact, that's where the blood is the highest pressure in the heart. And we measure blood pressure all the time, and people think of that number. Well, that pressure is generated from the pumping action of that heart. So if you're the chamber just on the back side of it, you're going to have a relationship pressure-wise with that chamber. And over time, things that affect pressure in the body affect pressure in the left atrium and result in that change or scarring that atrial fibrillation comes from. Those kind of risk factors would be sleep apnea, obesity, hypertension, and valve disease, which is also something that is a major contributor to this.
Okay. Well, let's start with sleep apnea then. Talk a little bit about how that affects heart health.
One of the most common things that people think about when they think about heart health or their cardiologist is how much they're going to get fussed at for not exercising as much as they should have. Well, exercising the heart, step back, you're talking about a muscle that continuously beats from the second you're, really, not the second, pardon me, 8 weeks in your mama's belly. So as a fetus, your heart is beating, and when it stops beating, we stop being. So you're talking about a muscle that will continuously beat your whole life. So that muscle needs to be appropriately exercised, which is why we always talk about exercise, but also it needs to be appropriately rested. And that's where sleep comes in. And sleep apnea is essentially like being suffocated intermittently while you sleep. And you have a large surge of adrenaline when that occurs. And that adrenaline creates hemodynamic changes. Your blood pressure goes up, heart rate goes up, and those brain waves that were nice and slow and undulous while you were resting and asleep go back to the frenetic awake subconscious phase. And so you end up feeling overall not rested, and the heart is not rested. So that lack of appropriate rest is what contributes to the cardiovascular sequela of sleep apnea.
Okay. And then sleep apnea is one, but you also mentioned some others, hypertension, and we can talk a little bit about what smoking does from a heart health perspective.
Yeah, so when we train, we are trained in cardiovascular diseases. We are not, our fellowship is not in cardiology, as most folks would think. It's in cardiovascular diseases, and that's a very important term. And smoking is an insult that creates inflammation. Inflammation is a root cause of a lot of different disease processes, and those inflammatory changes affect the vascular space in the blood vessels, not only of the heart, but of the entire body. And so we see people suffer from vascular disease from smoking every day. Every day. It's a terrible insult to your vascular system.
And so certainly we know if we can quit smoking or never smoke, that's going to help our heart health. If we can get a good night's rest and treat sleep apnea, that's going to help with heart health. If we wind up with the need for a procedure, we may need an electrophysiologist. But we can also talk about some things like diet and exercise. And certainly if we can control our cholesterol.
Yeah, so there are guidelines set forth of what target goals we should shoot for with our cholesterol. And those generally can be achieved by good diet and avoiding the allowance of your body to lead towards the development of diabetes. Diabetes is also a very terrible insult to the cardiovascular system. It diseases the small blood vessels first. And so the vessels of the vessels and the vessels of the nerve are the ones that get affected. And so that's why patients with diabetes develop neuropathies and then subsequently develop vascular dysfunction and vascular disease. So what can you avoid? How can you avoid getting to diabetes is watching a good diet and exercising. And in fact, I heard an endocrinologist once at a lecture describe diabetes mellitus type 2 that you develop as an adult is basically that you've poisoned yourself with food. You've eaten so much food and overeaten so much of the wrong foods your entire life that your pancreas and your body essentially begin to have dysfunction because of that. So diet is integral in maintaining what is the right thing to put into the system. The car runs better on better fuel. You're not going to go get bad fuel with water and try to ask your boat engine or your car engine to ride down the road smoothly. So we try to give it good fuel. Same thing for the body.
Very good. And so for someone who is focused on their heart health, choosing healthy foods, drinking a lot of water, getting some regular exercise, not smoking, and then watching that cholesterol. You talked also about sleep. So we want to make sure that we're getting a good night's sleep and that when we are resting, our body is actually doing that job and resting.
Right.
So as a cardiologist, as an electrophysiologist, do you see patients who have those symptoms but don't even realize that that's what's leading to their heart disease?
Certainly, yeah. And in fact, I think that most folks don't realize what kind of damage they're doing to their body just by living life. And so simple things that I bring up to patients are, in regard specifically to diet, is how many times a week should you eat at a fast food restaurant? And the answer is 0.
0.
Right. How many times should you eat food out of a gas station? And the answer is 0. And as we sort of try to find our way in this modern world where there is so much more readily available at the drop of a hat or around the corner than ever before in human history, you have to step back and keep perspective. Just because it's there doesn't mean you should eat it. And what you eat is like taking medicine. You know, I have a lot of patients who come to me and say, I don't ever want to be on any medicine. I hate medicines. I don't want to take a pill. And then I ask them what they eat, and as they are overweight, and they say, well, you know, I eat potatoes and I eat all the cookies and crackers I want. I said, well, that's very much the same way to think of food is the same way to think as medicine. So what you put into your body equals how you treat yourself. So you really need to focus on a low carbohydrate diet that excludes primarily the complex carbohydrates. So bread, pasta, rice, potatoes, those are bad culprits. Corn, beans even sometimes. If you're trying to really lose weight, you need to cut those out of the diet and focus on the kind of carbohydrates that grew up out of the ground, or focus on the proteins that are animals that ate what grew up out of the ground. You stick to that and avoid processed foods, you're on the way to a good healthy diet.
So one of those tricks you often hear is to shop the periphery of the grocery store. So you want your fresh leafy greens, fresh vegetables and fruits, the unprocessed dairy and meat, those kinds of things that are sort of around the edge of the grocery store. Because if we're going up and down the aisles, that's the things with the barcodes on them, which tends to be the most processed food.
Exactly.
Okay. And from the standpoint of what you all do in the cath lab, you've talked about kind of that heart health and the work that you can do. I've heard you explain about the electrical impulses from the top to the bottom, and I'm reminded of a description you gave of electrical impulses raining down. Can you talk a little bit about that and what's going on there and what you're correcting?
Right. So in a number of arrhythmias that the heart has, there are extra wires that create circuits. And those discrete circuits can be ablated with minimal burning inside of the heart. The tip of the catheter that I use to rid the heart of these kind of extra wires is 3.5 to 5 millimeters, depending on the kind of catheter that I'm using. So it's a very, very small tip. And so as I describe it, it's more of a sniper mission than a strafing mission. We're not going in and just trying to waste away the internal part of the heart, but more specifically go in and take out one small area in a focused ablative lesion so that it modifies the circuitry. In the case of atrial fibrillation, where the top chamber is quivering essentially with electrical activity as opposed to one electrical impulse that goes to the bottom for the following beat, that's what creates the fast, irregular heartbeats that atrial fibrillation has. And so that in and of itself can make the heart sick. Just having atrial fibrillation and creating that dyssynchrony that is developed with the pressure relationship of left atrium and left ventricle because of that erratic beating. So the rhythmic top-bottom beating creates the pressure flow through the heart that should work better. Once you disrupt that, you're talking about a muscle that is trying to pump blood. Imagine there's a difference between how Tiger Woods swings a golf club and I swing a golf club. To the untrained eye, it may not look that much different, but the subtleties are what makes all the difference. Same thing in the heart. Even minor variations of timing, and we're talking milliseconds, thousandths of a second difference, can create pathologic processes in the heart. So trying to resynchronize the heart and allow it to be in a rhythmic flow is really what I'm built for.
Very good. Well, we're glad to have you at St. Tammany Parish Hospital in the cath lab. You know, one topic we didn't talk about is a term that folks are familiar with, angina. Can you use a little bit of explanation for our viewers about what that is or what to be concerned about there?
So angina or angina is a description of chest discomfort. And in fact, if you flash back to the 1960s and 70s, people would have angina, they would give them nitroglycerin or some other medicines, and that was about it we had to offer until you had a heart attack and needed a bypass. As time has developed in the 90s and into the early 2000s, the technology of stents has come into play, and our ability to, from the intravascular space, without opening the chest and doing a bypass, we can go in through the arteries or the veins and open those in a number of different ways with balloons and subsequent stents, which are really engineered support structures. So angina is a result, generally speaking, of lack of blood flow or lack of delivery of oxygen to part of the heart tissue. And so just like you may have had in your life a Charlie horse from running or exercising, you got dehydrated. Well, that dehydration led to lack of oxygen delivery to that muscle. The muscle got angry. That's what angina is. Angina is a Charlie horse in your heart, basically. And so if you have angina, you need to find me or someone like me to talk to about it, because that is not normal. If you have severe disease, though, sometimes people have to live with angina, and there's nothing that we can do to fix that. So ways to avoid that are all the ways that we've talked about this morning.
Right. Diet, exercise, don't smoke, get a good night's sleep, take care of yourself.
That's right. And I think good, clean water, love, and enjoying life also contribute to that.
Very good. Dr. Stahls, we really appreciate you coming to talk with us about heart health and about what you do as an electrophysiologist. Our next guest will be from St. Tammany Parish Hospital's Cardiac Rehabilitation Program. We'll be back after these messages.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
We're back on Healthy Living, brought to you by St. Tammany Parish Hospital. Our topic today is heart health, and our second guest is Deborah Berger. She's a cardiac rehabilitation nurse with the hospital's cardiac rehab program. She'll talk a little bit about how exercise, eating right, and making good choices after a heart incident can really make a difference. So, cardiac rehabilitation, Deborah, can you talk a little bit about what that is?
Sure. These are folks who've had heart issues, heart attack, open heart surgery, valve replacement, chronic diseases like that. They've been treated by the cardiologist, and they follow up with us to exercise in a group situation. We monitor them. It also involves just a lot of education about their disease process, their medications, their healthy diet choices. It's very good as far as getting them with other people who have had similar experiences. So it's good for lifting the spirits and just heading them in the right direction to keep these things in check, you know, these diseases that they're trying to manage.
Good.
properly.
So our first guest was Dr. Stahls. He talked a little bit about procedures he might do in the cath lab and what you and your staff are doing at the Cortez Pavilion on Highway 1085 in cardiac rehab is kind of working with that patient after the cath lab.
Correct.
And there are 4 phases of cardiac rehab, is that right?
Right. They come out of the hospital. Depending on what they've been through, they need to be cleared by the cardiologist to start the exercise program. So the first phase is in the hospital.
Phase 1 is in the hospital.
Right. They actually get walked by the nurses, get educated about different things. Then they would move on to phase 2. And it depends, again, on what they've been through, how soon that, after surgery, it's usually about 6 to 8 weeks.
And phase 2 is when they meet you all and they're down at the outpatient
They
pavilion.
would come into the outpatient building and they go through an orientation process so they understand what's involved. We do a little screening as far as a depression scale. We ask them about their goals, some of their experiences with exercise and diet in the past. We talk about target weight and blood pressure and their different numbers with their cholesterol and things like that. And then they come in and they start the program. It's 12 weeks long.
12 weeks. And then as they make progress and they get stronger, they can move to phase 3. And is that at the YMCA?
We have phase 3 at the YMCA. We also have it in our department. So in phase 2, they actually are monitored. They wear a monitor,
Heart monitor.
and we watch the monitor while they exercise, and it's progressive exercise. So they start out, and then they progressively work up, and it's quite enjoyable for them. And then once they graduate from phase 2, which is 12 weeks, so they come 3 times a week, they'll move on to phase 3, and that's either at the Y or their own personal gym, or with us, and they're not monitored, once a month they're monitored there.
Right, so they're not on a monitor while exercising. It's once a month that we're checking in with them.
Right, and what we really want them to do is follow through with this. You know, we don't want them just to do the 12 weeks and then stop. This is a lifetime thing that we want.
And that's why phase 3 is called a phase, because we want to look at it like we've had the procedure, phase 1 in the hospital, phase 2 on the monitor, and then phase 3 is our lifetime after making those heart healthy choices.
Exactly.
So, all right, that's heart healthy exercise. Now, what about the other side of the coin is what we're putting into our bodies? How about a heart healthy diet?
Yeah, well, Dr. Stahls really covered a lot of that already, and he's absolutely right. You know, it is what we put in that's so important.
It is, and he talked a little bit about the lean proteins and certainly choosing the right carbohydrates, the leafy green vegetables, the fresh fruits, complex grains that your body's got to work hard to break down, not the simple processed white bread and things like that.
So if you basically, it's really not that complicated. You basically just need to think about what Mother Nature provides. It's lots of fruits and vegetables, lean proteins, those animals, you know, that graze on those vegetables that nature provides and eats those things, excuse me. Fish and low-fat dairy products. And carbohydrates are important. Our body needs them for energy. Our brain needs carbohydrates. So when we talk about that, we want those ones, like you said, that give us more sustained energy that our body uses over a longer period of time. They're complex because they're whole grains. Things that aren't white is a good way to look at it.
Okay, so stay away from the white bread.
Processed foods.
Choose, that's what we were talking a little bit about at the grocery store. If we're choosing those natural foods, the fruits and vegetables, the meats, the dairy, and not going up and down the aisles picking up the packaged foods, we're probably making some pretty healthy choices right there.
Exactly.
And then once we get it home, how we prepare it has some impact too. We could talk a little bit about how we spice our food or how much sugar or sodium we're adding to our food.
Yeah, I really don't think people realize how much salt is in food.
Particularly those processed foods.
Right, and like Dr. Stahl said, how many times should you eat out at a fast food restaurant a week is 0 because of all that sodium load and all that processed food. Those things are just so mechanical and processed and artificial and all that. So,
That's your heart attack all wrapped up in a nice fast food package, isn't it?
you know, that a good guideline for salt is to realize that a quarter teaspoon of salt has 500 milligrams. And your daily amount should be about 2,300 milligrams. So you're talking about less than a teaspoon of salt.
All day.
But most people get way more than that. So if you just read labels and become aware of how much sodium is in food, especially your processed things, your canned soups and frozen dinners, some of those contain like 700 or 800 milligrams in a serving. So
some of the most convenient food is actually some of the worst choices we could be making.
absolutely. And it's not that difficult to fix your meals. You know, you just have vegetables, some lean protein. You'd be amazed at how good it tastes when it's just easily prepared. And you can spice it up with other things like lemon juice and herbs, even a little wine when you're cooking with it. You know, just adds a lot of flavor.
Like Justin Wilson says, little sip for the cook, little sip for the pot.
Exactly.
Okay. And then, so if we're making those healthy choices in the kitchen and we're not driving through and we're not picking up our lunch in the gas station, then we've gone through our phases of exercise, we're taking good care of ourselves. The exercise can be as simple as taking a walk, is that right?
Absolutely, and you know, just if you think about it, if you just go out on your lunch break and walk for 10 minutes or 20 or 30 minutes even, really aim for about 2.5 hours of moderate activity a week minimum.
Right. And 2.5 hours over 5 to 7 days really means you can catch it in 10, 15, 20, and 30-minute stretches
Sure.
throughout the week.
And find something that you enjoy, and whether it's walking, swimming, find a friend to do it with. Even mowing the lawn or working in your garden is moderate activity.
Very
And
good.
unlike a dosage of medicine, I mean, there's no right dose of exercise, so it's
Well, and that's
important
it.
just
How
to
much a
move.
person needs has to do with their own health, what their cardiologist recommends, how far along they are in the cardiac rehab program. But for someone who is over average healthy and doing well, they should be exercising about 5 to 7 days a week. In other words, some activity every day.
Yes, about 30 minutes every day. Getting your heart rate up.
Very good. Now, speaking of the heart rate, obviously, if you're in phase 2, you're on a heart monitor while you're exercising. Once you're to phase 3, you are kind of on your own, except for that once a month you're checking in and you've learned the exercises and you're doing what's been prescribed. How do we as individuals know if our heart rate is about what it should be? Are there some rules of thumb, some things we can know?
It is. The younger we are, the higher our heart rate can get while we exercise without us suffering any sort of effects from that. But as we age, like Dr. Stahl said, you know, our heart changes. So the target heart rate is what we look for in phase 2. So we calculate that based on age. So basically it's 220 minus your age.
220 minus your age.
You come up with that number. And then you take 55 to 85% of that number, and that's where you want your heart rate to be when you're engaging in aerobic activity.
Right.
And that's a safe range for whatever your age is. So if you're 60, 220 minus 60 would be about 169 or 166. And then you take 55 to 85% of that. So that target heart rate for that person at 60 years of age would be between 88 and 136 beats per minute. So that's where we want them to fall while they're in aerobic activity. So if we see someone getting a little bit too high on that and while they're on the monitor, we'll tell them to back off a little bit. But we teach them how to take their pulse, and it's cute when they start looking at their EKG while they're exercising. You know, they're all curious about what their heart's doing.
Well, good.
And they want to hear that it looks good.
We all want to know our heart is healthy. Deborah, thanks for visiting with us
Oh, you're
today.
welcome.
We can all learn to keep ourselves active and eating healthy, whether we've had a cardiac incident or not. For those who have, you can learn more about cardiac rehab at stph.org, or you can call the cardiac rehab for information at 898-3750. Thanks so much for joining us on Healthy Living. I'm Melissa Hodgson, your host, and this is brought to you by St. Tammany Parish Hospital.